Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, October the 28th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, Brad, thank you and good afternoon. Well, we're all feeling the effects of the pandemic in some way. We know there are neighborhoods in our city where some of our more vulnerable residents are being hit harder by this virus. Over the past few weeks, we've seen the number of positive COVID-19 cases drastically increase, especially in the northwest part of the city. Since the beginning of the pandemic, we've been working hard along with local councillors, especially the councillors in the northwest part of the city, to ensure that residents are aware of what they can do to help us slow the spread of the virus, and just as importantly, to make sure that those residents continue to have access to the information, to the services, and to the resources that they need during this particularly challenging time for them and for the area of the city in which they live. Today, Dr. de Villa will be delivering an update on what public health is doing to help fight this virus in the Northwest. The government of the City of Toronto itself is also working to make sure that it is doing everything it can to help residents, of course, across the city, but especially in areas where we know there is increased spread of the virus, like in the northwest part of the city. For example, while the city doesn't administer COVID-19 testing or process the results, we are working to support community health centres conducting provincial testing where we can, and that means particularly in the Northwest. We have worked to make sure that we find ways to make city space available to community health centres and Ontario Health for COVID-19 pop-up testing sites in that Rexdale and Black Creek part of the city, or for that matter, any other place where a particular location can make a positive difference in terms of accessibility to testing. This week, pop-up testing sites have been requested by the Black Creek Community Health Centre and approved by Forestry and Recreation staff at Falstaff Community Centre, Oakdale Community Centre, Northwood Community Centre, Gord and Irene Risk Community Centre, and Chalk Farm Community Centre. So we've been trying to be responsive as quickly as we possibly can to the need for these places to do this testing on a more localized basis. We've also provided the Elm Bank Community Recreation Centre for pop-up testing by the Rexdale Community Health Centre last Sunday and this coming Sunday. This is based on careful consideration of how we can make testing as accessible as possible in places where it will make a positive difference. So these are examples of the cooperation underway to help people right now in that part of the city, working as between those responsible for testing and the city which has locations in which it can be carried out. Another successful cooperative effort was the work we did with the Government of Canada to open up a COVID-19 isolation site, the first of its kind in Canada, for people who can't safely self-isolate, because we know that has been an issue for families in the Northwest who in some cases reside in housing where close quarters make the concept of isolation very challenging, if not impossible. We're also partnering with many community-based agencies to implement programs and services in the Northwest and investing in these same agencies through the TO Supports Investment Fund. You may recall that last week we announced $1.9 million in funding through our TO Supports program to help several community-based agencies across the city, many of which actually operate in the northwest of the city. Through this TO Supports Investment Fund, the city has invested, for example, $283,000 to equip local agencies serving mainly Black Torontonians in Northwest Toronto to provide family support, mental health support, social connection, and community safety services. We further invested $820,000 in local food security programs in Northwest Toronto to support food banks, emergency food delivery, prepared meals, emergency food vouchers, and food handling certification. A priority for this funding was to ensure culturally appropriate food staples and meals are available to residents in their respective communities. The city continues to work with North York Harvest Food Bank, and of course, most of the northwest of the city, not all, is in North York, one of the TO support recipients as well, and that offers food bank service weekly from Toronto Public Library branches at Albion and Jane Shepherd. The city is now working with North York Harvest to expand food distribution throughout recreation facilities with a focus on neighborhoods. The Northwest will continue to be an area of priority attention in the next round of funding from the TO Supports Investment Fund. Early in the pandemic, the city and the United Way of Greater Toronto created the Community Coordination Plan to make sure there was a coordinated response and constant communication between the city, the United Way, and all the different community organizations. The United Way was uniquely suited to perform this role as between the city and all these community organizations, since they worked with both of us on an ongoing basis. That work helped to make sure that we got information to communities around masking protocols, physical distancing, virtual programs and services available to help people maintain physical distancing while still seeking the services that they need. We've also moved to make sure that we take other measures to help people to stay healthy, again across the city, but with a real focus on Northwest Toronto. And this has included the city providing additional funding and in-person mentor visits to childcare operators in the Northwest area of the city, as well as other COVID-19 hotspots, to support implementation of sound health and safety practices. Toronto Public Library Foundation continues to support the distribution of free laptops and Wi-Fi hotspots throughout the community agencies in the northwest part of Toronto, including Jane Finch Centre, Rexdale Community Health Centre, Unison Health and Community Services, Syme Woolner Neighbourhood, and Family Centre, just to name a few. The city has revised childcare fee subsidy policies to help families affected by COVID-19 by doing the following: increasing the number of sick days a child can be absent from childcare, and ensuring that the 28-day modified Stage 2 rollback does not negatively impact families' entitlement to a fee subsidy. Toronto Community Housing, the Seniors Housing Unit, is responsible for 6 senior-designated buildings in wards 1, 7, and 5 in the north and west part of the city. During the pandemic, TCHC has been distributing face masks and information materials to all senior residents, conducting tenant wellness checks for the seniors, and supporting prepared meal delivery to all senior tenants in the Northwest buildings. So this is just an idea of some of what the city itself has been doing, aside from public health measures that Dr. de Villa will talk about in just a moment. On the citywide front, I continue to work on the development of scenarios we can implement dependent upon existing circumstances at the conclusion of the current 28-day period of modified Stage 2. While ultimately the Day 29 Plus plan will be principally governed by public health considerations, considered carefully by Dr. de Villa and her team, I am trying to ensure that the term is taken in its broadest context, the term public health in its broadest context, obviously focused on COVID-19, but also taking into account broader conceptions of public health and overall individual well-being. I have made no secret of the fact that I am looking to see if we can develop, in a way that is safe and healthy, what I have come to call a doors open safely protocol or scenario that can help to guide us in the period of Day 29 plus. The objective here is to have a scenario available which is similar to how schools will reopen, seemingly safely and successfully based on experience to date, with a presumption they would be open subject to rigorous health and safety conditions. While health advice will ultimately come from health experts, as has worked very well for us in battling this virus to date, I think it is fair and appropriate for me to ask that post Day 29, that advice include careful consideration, as I'm sure it would have, but now I'm sure it will, of at least one doors open safely scenario, which allows us to look at what ways exist, if any, to in fact have doors open safely and see them remain open. Dr. de Villa will now update on current pandemic conditions across the city and on public health measures undertaken to assist our fellow residents living in the northwest of the city. Doctor?
Thank you, Mayor Tory, and good afternoon, everyone. Today, I am reporting 321 new COVID-19 cases. 140 people are now in hospital with COVID-19 and 37 are in ICU. It's widely understood that COVID-19 hits hardest in places that are low income or economically disadvantaged. And we know that racialized Toronto residents are especially vulnerable during this pandemic. Current data shows that 30% of people living in Toronto are classified as living below the low-income threshold, but they accounted for 50% of COVID-19 cases. Based on data, my team determined that over the course of the pandemic so far, Northwest Toronto stood out for higher rates of COVID-19, lower testing rates, and higher positivity rates in comparison to other parts of our city. One distinction worth making before we look at the specific numbers is that where a person lives is not a reliable indicator of where they got infected with COVID-19. The people of the northwest of the city are like everyone else, as likely to live in one part of Toronto, but travel throughout it. It's also important to recognize that a lot of hardworking people have to work outside of their home, delivering essential services that have to be done in person and on the job in places like hospitals, grocery stores, pharmacies, long-term care homes, and food production and distribution facilities. And they deserve our support as they go to work. The 3 wards that cover the northwest part of the city where rates are high are Humber River Black Creek, York Southweston, and Etobicoke North. Each of these wards is home to approximately 4% of our population. In contrast, Humber River Black Creek and Etobicoke North each accounted for 8.2% of all Toronto cases of COVID-19 in the last 3 weeks, while York Southweston accounted for 6.7% of our total cases. Another measure of the burden these areas experience is the case rate per 100,000 people. While the overall Toronto case rate has been 172.7 cases per 100,000 people in the last 3 weeks, these 3 wards experienced COVID-19 rates that were between 70% to 120% higher than for Toronto. Specifically, in Humber River Black Creek, it was 387.8 per 100,000. In Etobicoke North, 356.7 per 100,000. In York Southweston, 293.1 per 100,000. To sum it up, 3 adjacent wards in one part of the city, representing roughly 16% of the total population, or 23.1%, almost 1/4 of all Toronto COVID-19 cases over the past 3 weeks. Much recent attention has been given to the added value of looking at percent positivity. This information is reported to us at the neighborhood level, but I can tell you that these 3 wards contain neighborhoods with some of Toronto's highest percent positivity values. Only 4 of the 26 neighborhoods included in these wards had percent positivity values that were less than 4%. This is not a new story, just the latest chapter in a troubling one. Through the pandemic, there has been focus on the heavy burden borne by these areas and specific activities to address the imbalance. These activities are delivered by Toronto Public Health and by our partners in other city divisions and at senior levels of government. As you just heard, Mayor Tory described the efforts by our city partners. I will speak to many of the efforts led by my team at Toronto Public Health. Our work in Northwest Toronto and in any part of Toronto where the pandemic has or may yet hit hard breaks into 3 categories: providing information, direct interaction, as well as access to health services and health services promotion. Our most important way to reach people with vital information about COVID-19 transmission, prevention, testing, and social supports is through our COVID-19 Outreach Rapid Response Team. You will hear me refer to them frequently throughout my remarks today. Access to health services and promotion of health services helps people access testing. It also means advocating on their behalf to expand access to testing. My team works closely with Ontario Health's Toronto region to provide recommendations for testing needs and testing sites. My team also shares COVID-19 data like neighborhood case counts to work with community partners to identify appropriate sites for testing, which is funded by Ontario Health and planned and delivered at the local level by a variety of local agencies. We have used data to recommend the most strategic test sites in neighborhoods. The data helps us understand which neighborhoods have low testing rates, yet continue to have high rates of COVID-19 infections. These are areas that would benefit most from increased access to testing. Practically speaking, the results have led to testing in locations at community recreation centers, to malls, and even a church. It allows for testing where people are living their daily lives. Toronto Public Health's COVID-19 Outreach Rapid Response Team promotes community pop-up testing sites and collaborates with community agencies to help develop translated promotional posters and social media banners. In the 2 most recent months, we have helped raise awareness of testing access by promoting 17 pop-up testing availabilities. The team has also distributed test site information in the community through means like community canvassing, as well as distributing posters in various locations, such as apartment buildings, places of worship, and grocery stores. The Board of Health and Council have called on the province to increase the availability and accessibility of provincial testing in the Northwest. Providing information is the second area of focus. People cannot protect themselves properly without knowing what to do. The outreach team delivers presentations about COVID-19 to groups of residents, primarily those living in Toronto neighborhoods with the highest COVID-19 case counts. They address questions about transmission, prevention, testing information, and provide community support. The outreach team also present to community agency staff and volunteers to build their capacity in communicating COVID-19 public health messages to their clients. Presentations have been made at drop-ins, at senior services, cultural services, and community centers. Between mid-August and mid-October, the outreach team made almost 140 presentations, reaching 2,900 residents and almost 550 staff at community agencies. Direct interaction is also very important. 2 ways we interact with people in the Northwest and elsewhere are through canvassing and through information tables. Over the summer months, outreach teams conducted almost 80 community canvassing efforts at locations like shopping centers, grocery stores, and places of worship. They also set up information tables in various community locations, such as food banks, drop-in centers, and multi-unit residential building lobbies. Between mid-August and mid-October, this outreach allowed us to connect directly with more than 2,100 people. Between mid-August and mid-October, we also provided nearly 60 information table setups and were able to reach more than 2,300 residents. In a large, diverse city like Toronto, you can't operate on the assumption that everybody speaks the same language or speaks English fluently. This is why our community outreach team is multilingual and provides services in 28 different languages. Currently, information relating to COVID-19 is also being translated into approximately 30 languages. Wherever you live, the steps for self-protection are the biggest and best things we can do to limit the spread of COVID-19 in Toronto. This means keeping at least 6 feet apart from others as often as we can, wearing your mask whenever you can, washing your hands frequently, and trying as much as possible to limit your contact with the people that you live with. While we are all in this together, our experiences living with COVID-19 can be quite different. Those differences illustrate health inequity. Simply put, when the health of some people is different from others because the circumstances in which they live are so different, often so unequal, that one unfairly suffers where another succeeds. This is why our Board of Health and City Council called for the creation of a COVID-19 response equity action plan by the city and as well by the provincial and federal governments to eliminate the unequal impact of the pandemic experienced by many communities. The Toronto plan will be presented to our Board of Health in December, a plan to identify tailored, targeted action to facilitate good health in the whole city and to address the inequities that are felt heavily in neighborhoods such as those we've spoken about today. This work will need a united and concerted effort by all levels of government to support the conditions where all people are able to rise to their full potential. COVID-19 will not be with us forever, but the factors that worsen it in some parts of Toronto will not go away with it, not without hard work and a clear plan. The health of a city is determined by the health of the whole city. I feel confident we have seen in the pandemic a new understanding of what can be achieved when we work together. If COVID-19 has a legacy, I hope it will be a commitment to acting in ways that reflect the many things we've learned about ourselves through this, and a resolve to act in ways that reflect that knowledge. With that, I'll turn it back over to Brad. Happy to take any questions.
Thank you, Dr. de Villa. We do have a number of staff on the line to answer the specific questions, including Chief Pegg. Our first question is to Megan King from Global News. Go ahead, Megan.
Hi there. This is a question for Mr. Mayor.
Yes.
Hi there, Mr. Mayor. Canada's largest fitness company, Good Life, has asked its members to reach out to their MPPs to help get their gyms reopened. In Toronto, they are closed for 28 days. Do you think it's safe for gyms to reopen given the rise in COVID numbers?
Let me put it this way, and it fits very much into what I was talking about in terms of a doors open safely kind of approach. I think there can be a way found where in certain circumstances, subject to certain conditions, we could have gyms reopened. You'll recall that the advice we received and that we passed on to the provincial government back a little while ago was that it was group activities in particular that perhaps formed more of a danger to public health. But I'm not presuming upon that still being the case today or anything else. I'm not a medical expert, but I think that one of the reasons I've asked for doors open safely scenarios to be brought forward is so that we can find a way in which we can have people have access to what are healthy activities to the greatest extent possible, but still safe in the context of public health. And I think there can be a way found to do that.
Thank you. And on to patio season. While City Council has approved an extension for patio season to support local restaurants, curbside patios will still have to close due to snow removal necessity. How are these businesses being told about this? And do you think they have enough warning to decide whether to stay open or not? There seems to be some bars that weren't aware that they wouldn't be able to operate.
Well, going from memory, I think I first started talking about the absolute necessity because of snow clearing, nothing more and nothing less, but it's very important that I started talking about this probably 2 weeks or more ago, very publicly, repeatedly. I think that around that same time, there were notices that were given of the fact that we would begin the process, because it didn't all happen on one day, of removing the things that protected this space in the curb lanes for use as patios. And so I'm sorry if people haven't received that news and were caught a bit by surprise, but I think it was always fairly self-evident that we would have to clear away these spaces for the winter months because of the snow. and that it is my fond hope, and I'm really looking forward to receiving a report from the staff that will allow us as soon as possible to say to those very same businesses and to the people who enjoyed those patios, they will be back as soon as we can get the snow cleared away and spring comes in let's say, April. So that's the objective.
Okay, thank you. We'll go next to John Chidley Hill from the Canadian Press. John, go ahead, please.
Mr. Mayor, this question's also for you before you put that mask on. You just spoke about trying to come up with a plan for reopening gyms. I'm curious, why is it important to reopen gyms?
Well, I think it's important to reopen as much as we can, because I think that if you look at this broader context of public health, which I've learned about from Dr. de Villa, among others, which says that it isn't just about people not having COVID, which is extremely important, obviously, but also it's about their state of other physical well-being, it's about their mental health, it's about their financial state of health. This is all part of what causes people to be overall healthy in our city. And part of that is the opportunity to go to a place where you can get exercise. And increasingly, as the weather gets colder, people will be looking to do that in settings that may be indoors. So the challenge for us is to have the doors open safely so that people can go to gyms or many other places, including restaurants, but do it safely with the maximum number of rules and regulations in place that promote safety while still making it viable for places to be open. But physical exercise and the ability to go places like that, even just the socialization that it involves for people who've been cooped up, are all important, but you have to do it safely. And so that's what we're working to try and find that way right now.
Thanks, Mr. Mayor. I don't have any follow-ups.
Okay, John, thank you so much. We'll go next now to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. I was just wondering if you could first just clarify these pop-up locations that the mayor was talking about earlier. Are these areas which the province have approved pop-up testing will proceed this weekend? And I'm wondering, just to Dr. de Villa, obviously the Northwest is one area where you're looking for more information through testing, but I'm wondering if you could tell us what other areas you have requested the province step in to allow more pop-up testing or even more access to testing so that Toronto Public Health can get a clearer picture of exactly what's going on there.
So Matt, to the first point you raised in your question, so testing and access to testing is really something that is under the provincial jurisdiction. They oversee all of healthcare, and testing is indeed part of healthcare. It is something that we have to liaise with, and of course our data help to inform where there are areas of COVID-19 activity. And as well, we have data now that we are publishing and sharing with relevant partners, including our provincial partners, around where testing rates seem to be falling behind and therefore would be areas where more testing might be warranted. So we're providing that forward, and the ministry and its healthcare agencies and partners who actually engage in that kind of work in direct frontline on-the-ground healthcare are working with Ontario Health and other provincial agencies to make pop-up testing and other forms of testing available, premised at least in part on the data that we provide. So as we get data and understand which areas of the city would benefit from increased testing, that's the kind of thing through our liaison functions, both with the province and with community agencies. We put information out there and suggest, look, what we're seeing in our data is that there are certain neighborhoods throughout, various parts of the city. Based on testing rates, they look like they could use some more testing. Who is around in the area? Who has connections into that community? Who knows where the testing might actually be most valuable, meaningful, and resonant? And how do we connect with people, residents within that community, so that when we set up testing efforts, they're likely to be successful? That's the kind of work that we do, and it's the kind of partnership that's necessary to solve the challenges of COVID-19.
Okay, and I'm just wondering, at council this morning, there were a number of questions directed at you about areas where you can identify where transmission is occurring, because you've of course said repeatedly that just where somebody lives doesn't mean they've caught it there. But I'm just wondering, are you able to actually identify those zones and put that data out there? And It seemed like the suggestion was that there could be maybe some areas where there is low transmission rates where they could perhaps see fewer restrictions. Is that possible? Because I know New York has cluster zones and buffer zones. Is that something you could do on a smaller scale in a city like Toronto?
Well, I think there are a number of different options that we're all constantly trying to explore. The New York model is certainly one of them. We've seen, areas that are providing for hot zones and buffer zones around them. And we've seen other jurisdictions just go to, straight out lockdown. As you can see, this is something, and it's a circumstance where we're all learning very much in real time, simply because this is a new virus. What I can say is that when we do look at transmission here in the city of Toronto, we do know, and we have reported out where there have been clusters. And notably, when we talk about transmission, that's exactly what we're talking about when we talk about outbreaks. And on our website, we actually have a specific component of our website dedicated towards outbreaks. And as per direction from the Board of Health, we are actively working on upgrading and constantly improving that section of our website that describes outbreaks, so people might actually have a better sense as to where transmission is happening in our city so that they can take appropriate action.
We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi, this question is for both Mayor Tory and Dr. de Villa. You've been urging people to follow all the rules, and in some cases, when there's specific examples of people breaking the rules, have sort of called them out from large parties and so on. I'm wondering how you both react to a photo of a member of the provincial government standing, smiling with 40 other people, not a mask in sight. Sam Oosterhoff has said he apologized for momentarily taking off his mask, but as I said, there's no masks there. And in fact, the owner of the restaurant where it happened says he repeatedly asked the MPP and the other guests to put on masks, and they did not. How do you tell people to follow the rules when there's that example out there?
So, I have to be upfront. I have not seen the picture myself. I have heard about this, and obviously, I recognize that this is challenging for all of us. I think we've heard a number of people comment on the experience of pandemic fatigue. And, I think if we're all being very honest with ourselves, I think we're all suffering from a degree of pandemic fatigue. It has been a very long, several months now of fighting COVID-19. So I suppose within the realm of public health, we feel a special brand of pandemic fatigue, but we too are members of the community and suffering many of the same challenges that all of us are living through, having to restrict our activities and adapt and adopt new practices that frankly are not natural to us. So I think, as with everything, I think we're constantly seeking to resolve to do better with each and every day. And I would hope that the same is true of our leaders. And I'll turn it over to Mayor Tory if he has further comments.
Well, I have seen the picture many times, and I can only describe it as unfortunate. But, what was as stunning to me, I myself, one time went to a park and pulled a mask down that I was wearing and was rightly criticized for that, and I apologized for that. I have had my picture taken many times in the period since then, over the last few months, by people where I was and they were wearing a mask, but nonetheless, they got too close to me, and I've had to go to great efforts to make sure people didn't get too close, certainly not without a mask, or people want to touch you, and it's just part of what normally would be going on. What was more surprising to me, again, it's unfortunate that an elected leader, a person with a public profile was not wearing a mask, was that the person was surrounded by 40 other people who also weren't wearing masks. So a big crowd of people standing very close together, not wearing masks, any of them. And that is something we've been talking about every day, saying, if you are going to be in a circumstance where you can't keep physical distance, wear a mask. And I'm not sure there still wouldn't have been some public discourse about this if all the people had been wearing masks standing in such close quarters. But to have the two things happen was very unfortunate, because it just undermines, the message that we're trying to get out there about the importance of wearing a mask. I'm one of those who believes that people should wear masks as often as they can, for as long as they can, in as many places as they possibly can, because I think it will actually make a real difference. But it didn't clearly happen there, and that's unfortunate.
Thank you. I have no further question.
Okay, Dave, thank you. We'll go then to your colleague Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. My question is for either Mayor Tory or Dr. de Villa. Are you starting to see that restrictions are resulting in worse all-round health outcomes than not having restrictions? Is that why we're starting to hear some language about, preparing a reopening plan for day 29?
So I'll start off, Francine. What we have noticed and what I have been impressed with throughout the entire pandemic is, the commitment of Torontonians. I really have been impressed, despite being very, very tired. And I know that there have certainly been health impacts across the board. You've heard that which we've spoken about in the northwest of the city, but it's not exclusive to the northwest. I think that what you have heard from us throughout the entire pandemic has been the objectives that have not been exclusively in one direction or another. The objectives throughout the entire response to the COVID-19 pandemic have been to mitigate the impacts to the greatest extent possible of COVID-19 directly on the health of the people of Toronto, to preserve the capacity of healthcare to respond to the many needs that our city has and its population has, and of course to mitigate those broader health, social, and economic impacts. I think we have worked very hard, not only here at Toronto Public Health and in concert with other city divisions and other government partners, but as well with our communities to try to achieve that balance as best as possible. And I think what I can say is that you will continuously hear us and see us striving to achieve those objectives in as balanced a fashion as is possible. And I'll turn it over to the Mayor.
Well, my main point in bringing forward this concept of a plan for day 29 and going forward, and the concept of doors open safely, is really just to start from the premise that you have to have a plan when you end this 28-day period. You can't just come out of that and say, well, we're back to whatever business as usual was. I will admit that I have a bias to a plan that can have doors open safely in as many places as possible, simply because I've learned from Dr. de Villa and others about this broader concept of public health that says that if people are out of work, they can't feed their family or themselves properly. They may not be able to pay their rent and might lose their housing. They're going to have mental health issues by virtue of the fact they're in crisis because of a lack of work or whatever in their family. So this is a broader context within you look at public health. And secondly, I think that people out there in the city of Toronto want to see that we have a plan because they have the right to expect that from us as a matter of maintaining public confidence in us. I think they have been confident, and as Dr. de Villa said, they've responded extraordinarily well in terms of, for all the talk about non-compliance with masks on the TTC or those kinds of things, people have been extraordinary in their compliance and their cooperation and their understanding. But I think they also would expect we would have a plan that isn't just static and stays the same all the time in a circumstance that's rapidly changing, and that we would have a plan that takes into account this broader requirement of public health so that we can try to move ourselves back towards a more normal existence, but in a way that is safe and healthy for everybody. So that's exactly what has been behind my comments, and I've shared those comments with the Premier and with lots of other people that I've been talking to try to get their views, but also to say that I think this is something we just have to be doing as a matter of the responsibility we have as public officials.
And my next question is for Mayor Tory. How would you describe the impact that COVID-19 has had on independent businesses in Toronto?
Devastating because you went in a independent businesses that have been around for some period of time are used to recessions where you lose a percentage of your sales and where some of your activity is curtailed because of economic slowdown. What nobody's ever experienced before in our lifetime, I don't think, is a complete cessation of business, which they went through for a period of time in some cases. In other cases, they've had several of those complete cessations of business because of public health measures. And so I think this has caused liquidity crises. They've told me that because I've spent extensive periods of time talking to and listening to businesses. It has caused, for many layoffs to have taken place, even where those businesses did survive, but with far fewer people. It has caused businesses to be lost. So it's caused untold anguish and damage to the economy. And what you have to hope, just like grass that sometimes will die is that there's a way in which it can come back if you water it and care for it, and if we get some break on the health side and maybe some, kinds of new approaches that we're talking about now for the next stage of all this. But it's been devastating, and I'm confident that Toronto has such inherent strengths. We are seen so well in the rest of the world. We are such a linchpin to the success of this country that we can come back, and some of those businesses will come back, but some won't. But it's been devastating. I don't think there's any other word that you could possibly use to describe it. Even that might understate the impact that it's had.
Okay, thank you. We go next to Richard Warnicker from the National Post. Richard, go ahead.
Hi, this question for Dr. de Villa. Dr. de Villa, have you seen any evidence or any suggestion that people who really do need COVID tests, so people who are symptomatic or who are close contacts of a known case, are avoiding getting tested in any kind of numbers?
So what I have certainly heard from community partners in particular, who are a little closer to members in our community and residents in the community by virtue of where they're situated, have spoken about challenges and some reluctance on the part of members of the community to get testing. So I certainly heard that, but not directly. It's been through other partners.
And what kind of reasons, I guess, are then you hearing secondhand for that reluctance?
Well, I think there are a number of reasons. For some people, the harsh reality is that if they are diagnosed with COVID-19, there is concern around what that means for work, given that there are isolation issues, and what that will mean for family livelihood. If you're the sole breadwinner and you are unable to work and your circumstances are such that if you're not working, you're not taking an income, your entire family livelihood is seriously in jeopardy. So that's one example of the kinds of an issue that might actually get in the way of people taking advantage of testing, even in circumstances where that testing is warranted.
Thank you.
We'll go next to Jane Stevenson from
Oh, hi, this is for Mayor Tory. Just getting back again to the gym question. Part of their arguments from gym owners is that the dance studios were allowed to reopen and that they should be treated the same. Do you agree that dance studios and gyms should be treated the same in terms of whether they should be closed or open?
I won't just sounds like it makes sense. Distinguishing feature with the dance studios, I believe, when they were considering reopening them, which they ultimately agreed to do, the province that is, was that dance programs have a defined enrollment. So you knew exactly who was going to come, how many people were there, and so on. Is it possible that you could have gyms operated in a way, as I think was the case previously, where you had a certain restricted number of people in the gym at a given time? Is it possible you could do it without the group activities, which is something Toronto Public Health had recommended in previous times, so you don't have that kind of uncertainty in group activity? Yes. Should they be treated as being exactly the same? I don't think they are. But I think that what's needed here is what I'm sure is happening, which is a careful examination. We now have about 10 days left in the 28-day period, a careful examination of gyms, their utility to people's good health, as was asked about earlier, and to socialization, but also at the same time the risks that they do pose as places of congregate gathering. And I'm sure that we can come out with something that could see them open safely, but that's what we're working on across the board in all these different kinds of businesses, to see if there's a coming together of the desirability of having them open, the desirability obviously from a business perspective of having them open, and good health and safety for people, which is something that we've obviously been deeply concerned about always, but especially in the last 6 or 7 months.
follow-up, Jane?
No follow-up. Thanks very much.
Okay, thank you. We'll go next to Lucas Meyer from News Talk 10. Lucas?
Thank you very much. Mayor Tory or Dr. de Villa, really, just to get back on doors open in the gyms, all this talk about, having a plan ready, I'm curious if Toronto Public Health has specific recommendations as well around this. For example, on day 29, when they open back up, certain classes maybe being closed for a certain period of time or something like that. Are there specific recommendations that the city is making to the province, and if so, what are some of those?
So Lucas, I think that's an excellent question. And if I can paraphrase what the mayor was saying earlier, really it's beholden on us as professionals to start planning in advance, right? The best thing to do in terms of readiness and what's most responsible, I would say certainly for us as public health practitioners, but for the entire city as, an important level of government and one that seeks to best serve its residents. It is important to plan in advance rather than waiting until the last minute or waiting until day 29 itself to, come up with a suggested plan or course of action. So I can tell you that we are absolutely having active conversations, and we have had them, over the course of the last 2 weeks, and I expect that conversations are going to continue over the next several days around what makes the most sense from our perspective as public health professionals. Clearly, we're not the only partner involved in this. Certainly, our provincial counterparts will have to play an important role in that discussion. We are absolutely, in conversation with them. We're in regular conversation with a variety of provincial counterparts. And of course, we're always interested in hearing that which our stakeholders and our community has to say. So it is an active discussion, and I would just ask you, Lucas, to stay tuned.
I will. Mayor Tory, then. Yes, please. Yes.
The foundation piece for all of this is good health. Obviously, I mean, we're not going to spend all the time and effort and all the sacrifice people have made to fight this virus and then not use that as the foundation piece for a doors open safely or any other kind of policy. But I think what I felt, and I mentioned this probably 10 days ago publicly for the first time, that I had asked Dr. de Villa to work with us on formulating a plan, which they were, of course, doing, because you need a plan. When you come out of a 28-day period, you need to have a plan as to what you do on day 29. I've also spoken to the Premier about this, and we both agreed that we need to have a plan. And now the challenge will be for us, and I'm sure we can do it because we have on many other things, to take all the different people who are giving and advice, including the foundational health advice on this, and get them together, as is going to happen, and decide hopefully on one agreed upon plan that can hopefully get us to a stage where we can open doors safely and keep everybody as healthy or healthier than they are today. That's the objective.
And on the economy, Mayor, I'm just curious. We've got Black Friday coming up, in November. Are we going to see, because this could be a make or break for a lot of businesses, is if people really shop on Black Friday, ahead of Boxing Day and the holiday season. Are we going to see kind of a big local campaign, with either advertising or commercials or what have you within the city to get people, safely supporting local businesses for Black Friday? Is that going to be kind of a really visible campaign kind of effort?
I'll be very honest with you. We had a campaign ready to go to get people to shop local and dine local, and it was all in preparation and ready to go. But then the second wave started to hit. This was some time ago in the fall. So we obviously postponed it. It made no sense to be telling people to go out and dine local and shop local when some of these businesses were closed and when we were giving them advice basically to stay home if they could. So a lot of that work in preparing as to how we could get people to shop and dine local has been done. And now as we approach Black Friday and other days as we get into the holiday season, we will be having a look at what makes sense within the context of the health advice and the plans that are in place by way of promotion. So the answer to your question is we will have an effort to be made in that regard, but it has to be calibrated around what the health advice is first and foremost.
Okay, we go next to Momin Qureshi from 680 News. Go ahead, Momin.
This question is for Mayor Tory. Mayor Tory, yesterday Councillor Pasternak tabled a motion to see if the city could get some interest from the province again about road tolls of the Gardiner and the Allen. But then a short time later took it off the table, saying that there was he didn't want to jeopardize some sort of discussions that were happening higher up in back channels. And I was just wondering if you could shed light on that in terms of what those discussions are. Is the city trying to get road tolls back on the table?
We have had no discussions about road tolls. I guess what I often feel about these things, and I'm just being honest in terms of how the process works best, is if there's a motion passed or a press release issued and somebody goes to the Minister of Transportation and says, what do you think about that? The instinctive answer is going to be to say, no, we're not thinking about that. We probably won't do that. I'm obviously in favor of road tolls on the Parkway and the Gardiner. I initiated the idea. I voted for it at City Council. I took it to the Premier of the day, and the rest is history. But having said that, there are no discussions going on about road tolls at this moment. With respect to the idea of HST being taken off restaurant meals, we've had ongoing discussions continuously, and as recently as yesterday, with the Government of Canada in particular about ways in which they can help the restaurant industry. And they've been quite precise, the industry has, in talking about how we can help them with their rent, how we can help them with their wage subsidies, things the Government of Canada has stepped forward and helped a great deal on. And so what you don't want to have happen is have those discussions going on the one hand, and then some motion, which undoubtedly would have been passed, who's going to vote against it? On the other hand, and then you get the government calling you to say, well, now you said previously it was about rent and it was about wage subsidies and things like that. Is it now something to do with tax revenues on HST? So it's just one of those things where these kinds of confusing messages are not helpful when you have active discussions ongoing on the restaurant front. On the road tolls front, the subject has not been under discussion to date with this government at Queen's Park.
And just as a follow-up, I know you're in support of Councillor Ford's motion to restrict some of the fees on the food delivery apps. Yesterday, the Premier said that he thinks those fees are too high and he'd like those companies to scale it back and that he's willing to have a conversation with you about it. So I don't know if you've had that conversation yet, but when you do, what will you be asking for specifically?
I think the government should move, to cap those fees for a period of time to help these restaurants stay in business. Just as the government is helping with wage subsidies for the restaurants, the government is helping with rent assistance. We have helped in a number of different ways through things like Cafe TO and the patio situation. I think these companies that get their business, whose customers are the very restaurants that are suffering, should be stepping forward as a matter of good corporate citizenship and just sound business and saying they're going to give them a break for a period of time. Let's pick to the end of the year. I think that was a great step forward. But so far, even in direct conversations with them, will tell you about other things they're doing, and I don't deny that they're doing some other things, but none are going to be as meaningful, I don't think, as taking these gigantic commissions that really suck the blood out of the efforts that people are making to support their local restaurants and make it to the point where those meals that are served and purchased and then delivered are almost a loser for these restaurants. It makes no sense. And so the Premier and I will have to discuss this further if he has any interest, and the motion, I trust, will be passed. Maybe it has been while we've been speaking here, but I think that will just be one more thing that hopefully sends a message that these people should take this initiative on their own instead of being told by government to do it.
A final question, Mr. Colin Cote from Radio Canada. Colin, go ahead, please.
Hi, the question is for Dr. de Villa, I think, but if Mayor Tory wants to join, you can do it after. Premier Ford seemed to be pretty optimistic regarding Christmas time and the curve today during his presser. I was wondering what you were thinking about what he said, like, let's work together to make Christmas happen.
Well, I don't think there's a single person in the city of Toronto who doesn't want to have, a Christmas like we're used to having it. And I would count myself amongst those who would like to have a Christmas celebration. I think, as hopeful as I am, and as much as I want that to happen, I would really like to see, where we are, and we will make determinations once we have a better sense of where we're going. But I think the best way for us to get there is for all of us to continue to practice those self-protection measures that you've heard me say so many times. Watching our distance, limiting our contact as much as is possible, to stick with those with whom we live, wearing your mask as much as possible. You've heard the mayor talk about that. As much as you can, wherever you can, wear your mask. It actually does help. Wash your hands. Stay home when you're sick. And for now, please get your flu shot. It is available and it will make a difference. Mr. Mayor?
People do have to have hope. And I think, having been through the experience of Easter and Thanksgiving and the cancellation of a whole lot of events in the city that people love, like Pride and Caribbean Carnival, and the list goes on, I think if they can have a sense of hope, then I believe that may motivate them to do what will allow us to wrestle this thing, at least partially to the ground by Christmas and by Hanukkah and by holiday season, the end of the year, New Year's Day. So I think the Premier is right to be talking about being hopeful, because I think we've all got to be hopeful, but with hope goes the need to take action. And I think if everybody gets on board and puts on the mask and washes their hands and keeps their distance and avoid crowd scenes, there's every reason to be hopeful, but we got to do it. And I think people are, but we've got to redouble our efforts. And I think you've always got to have a goal in mind. And if getting things back to more normal by holiday season is the objective, that's fine with me.
Yeah, and just Dr. De Villa, just on the curve in general, I mean, the number of cases rising and et cetera in the city, like on the tendency, basically, not the daily cases, just to have your input on the future, maybe, you know, the upcoming days or weeks.
Well, it is always challenging to try to predict where things are going to go. But what I can say is that when we look at our numbers, and I would encourage you to follow along with our monitoring dashboard, that really is a great source of information and can give you a sense as to where we've been, and I suppose give you the basis on which to start to make some predictions or try to imagine where we might move in the future. But certainly moving our pandemic in the right direction, getting case counts down, and really focusing on controlling virus spread in our community does rest with each and every one of us, and how well we are able to stick to those practices that we know make a difference. We know this worked in the spring. We have, we know more about this virus. We have more knowledge now, and we know it makes a difference for us to limit our interactions, to really focus on those activities that we need to do, and determine and distinguish them from the ones that we want to do, so that we can try to limit the opportunity for the virus to spread. Remember, the virus actually needs us to get into close contact with each other, ideally without a mask, right? Without physical distancing, when we're sick, without washing our hands. These are the kinds of things that actually promote virus spread, and these are the kinds of things that we know what to do about, right? We know we need to watch our distance. We know we need to wear our masks. We know we need to wash our hands. That's how best we can limit virus spread and transmission from one person to the next. I think what's interesting, if I can just speak to the data one more time, when we look at our current situation here in the city of Toronto, that reproductive number that you've heard us talk about in the past, it tells us a little bit about how much more cases, or what's the average number of new cases that each single case of COVID-19 causes, and we're still hovering at about 1. We know at this level of cases that we've got right now that we can, if we can push it down a little bit further, we will eventually see the virus die out. It will take some time, but that time is shortened the more we are able to practice those self-protective measures diligently every single day.
Okay, thank you, Dr. De Villa, and thank you, everybody, for joining us. That concludes today's meeting.